My name is Joan Jones Solomon, and I did my study on treating obsessive compulsive disorder in older adults using cognitive behavioral therapy. Obsessive compulsive disorder is an anxiety disorder that is classified by repetitive and compulsive behaviors that vary in degree caused by anxiety. 50% of those diagnosed with OCD are diagnosed with a severe classification. Examples of OCD behaviors are frequent washing of hands, checking if a door is locked, and hoarding, to name a few. Cognitive behavioral therapy is known to be the most effective treatment of OCD. The purpose of this study is to examine OCD in older adults and the effectiveness of cognitive behavioral therapy. In social work practice and research, OCD can be an underlying and underdiagnosed issue a client may be facing that will prevent progress and hinder the work of the social worker. Because those with OCD seek control with their behaviors, it would help social workers to know and recognize OCD in order to help clients gain control in their lives where they feel there is a lack. Prior to conducting this study, there were 5 articles found where OCD was observed in older adults as well as younger children. Reed, Stork, and Murphy used the Yale-Brown obsessive-compulsive scale to observe OCD symptoms in individuals who were 19 to 79, and they found that if OCD symptoms are left untreated, as a person gets older, the symptoms will only get worse. Adams Jr., Ryman, Witterneck, and Sessler, in their study, observed OCD individuals and individuals who did not have OCD, and found that people with OCD have intrusive thoughts that are exaggerated, and that if not acknowledged by them, they will only get worse, and this is the cause for OCD symptom severity, and that it will most likely mean that not only will a client need cognitive behavioral therapy, but also medication. Simpson, Wang, Maher, Bao, Fowl, and Franklin found in their study that people with OCD who follow cognitive behavioral therapy step by step are more successful in treatment than those who don't follow treatment step by step. Tolan, Diefenbach, and Gilliam examine how cost-effective and the efficiency of standard cognitive behavioral therapy to step care therapy, cognitive behavioral therapy. They found that step care cognitive behavioral therapy was more cost effective than standard cognitive behavioral therapy, but both therapies were equally effective. Roshanai, Mohagdam, Pauli, Atkins, Baldwin, Stein, and Roy Byrne in their study examined relative effects of cognitive behavioral therapy and pharmacotherapy in depression versus anxiety, and if medication is for depression and if cognitive behavioral therapy is better for anxiety. They found that regardless of cognitive behavioral therapy or medication to depression or anxiety, they were both equally effective and had no harmful effect to the client. My research question is, does cognitive behavioral therapy reduce symptoms of OCD and anxiety among older adults? And this study will broaden research of how OCD affects individuals who are older adults and not just as young children. In recent studies, they found that OCD symptoms become more apparent and are first noticed in children who are young adults who are 19 years old. And so there have been more studies geared towards finding out those causes of OCD beginning at age 19 in individuals, and there have been less studies on individuals with OCD as older adults. For my study, I used the AB design. This design measures the baseline of a measure, which in this case is the OCD symptoms, multiple times, and the treatment intervention, which is in this case cognitive behavioral therapy, to see if their interaction can determine if the treatment is effective and the root cause of the change in behavior. This design was chosen because it was the most effective design to observe the effectiveness of the treatment. Um, in this study, there were 4 baselines measured and 5 intervention baselines measured. The independent variable for the study was cognitive behavioral therapy, and the dependent variable was symptoms of OCD and anxiety. Uh, the targeted sample population for this study was 75-year-olds and older who had OC or who has OCD and anxiety symptoms. In order to collect this data, the researchers had to meet the client at their house, a place of residence, or within 10 miles of their residence. They met on Tuesday and Thursday, the 2 weeks before the intervention took place, the treatment took place. The treatment lasted for 12 weeks, and data collected on the progress of their behaviors and symptoms with the treatment were collected on week 2, 4, 6, and 8, and at the end of week 12. The duration of the time that it took to collect the data was 35 to 45 minutes. The measure used to collect the data was the Depression Anxiety Stress Scale 21, or DOS 21, and it is used repeatedly in studies related to disorders that are related to depression, anxiety, stress, and OCD, and it has become a more valid measure. In order to you score the measure, and then in this case we used the short version of the scale, which is only 21 items, and it has 7 subscale items to the measures of depression, anxiety, and stress. Each item asks the individual how much the presented statement applies to an individual over the past week on a scale of 0 to 3. 0 meaning it does not apply to all, and 3 meaning it applies very much. It does not 0 meaning it does not apply at all, and 3 meaning it applies very much. The individual scores are then added for each scale and given the corresponding level of severity: normal, mild, moderate, severe, and extremely severe for each scale. Here is a picture of the DOS-21 showing what 0 through 3 mean, and a few of the statements are 21 of the scales examples. Here is a scoring template for the researcher scoring the measure for each individual. Here is, you see, S stands for stress, A stands for anxiety, and D stands for depression, and it would line up with the numbers of each scale item to determine which subscale it is linked with. Again, here is how the researcher would score the scale of an individual and determine the severity. To determine the results of the study after the 12 weeks of treatment, the client's responses to the DOS-21 will be reviewed to conclude the effectiveness of the cognitive behavioral therapy to the symptoms of OCD and anxiety. After treatment has been completed, the findings are expected to show that the client's depression, anxiety, and stress levels decrease along with any OCD symptoms that were present before treatment. The results of the study showed that the treatment of cognitive behavioral therapy effectively addresses the symptoms of OCD and anxiety in older adults, and the symptoms decrease with treatment. The strengths of this study showed that though untreated symptoms get worse with age, cognitive behavior therapy is effective in helping clients cope with this disorder. The clients who are older cope with this disorder. Limitations of the study. Only one measure was used in the study, and only one researcher collected the data. which proves to be some bias by that can be proved that there was some bias by the researcher. Implications of the study is that there is a lack of knowledge on how cognitive behavioral therapy works for older adults, and this study helps to fill in the gaps where there is a lack of research and opens the door for future research. Lessons learned from the studies that by reviewing previous studies and applying them to areas of the field and the interaction of clients and social workers, it helps to strengthen success of services to clients. And here are my references.